everyone, my name is Mugdha and I'm a certified PCOS nutritionist at Veera Health with over 5 years of clinical experience. I follow medical nutrition therapy, meaning for me, food is medicine, and if you have right kinds of foods in right proportion, then it has the ability to heal our bodies, and that's exactly what we do at Veera Health as well. At Veera, we follow a unique technique to help you sustain habits for a long period of time. We call it the habit building program, in which we focus on one habit at a time and help you master it before we can move on to the next one. For some women, eliminating gluten is recommended. Now, gluten is found in so many different products that we eat on a regular basis. It is difficult to eliminate or restrict gluten intake. At Veera, we follow the habit building plan to help women identify their gluten sensitivity and form habits that aid in restricting gluten intake. So guys, first, let's talk about gluten today. There is so much buzz around gluten these days, and if you have PCOS, chances are you may have come across women online that claim that going gluten-free has worked wonders for their PCOS. So does going gluten-free really help manage PCOS symptoms? What is gluten anyway? And should you go gluten-free? Let's just discuss. So to start with, what is gluten? Now, gluten is a protein that's found in breads, roti, pasta, basically all wheat products. It is also found in foods made up of rye, barley, which is also called as jaw. Even some oats may have gluten. Think of a pizza dough. The stretchy and elastic quality of the dough is because of the gluten. It acts as a binder in the dough. For some people, gluten triggers an immune reaction, and eliminating gluten is recommended for them. Well, the answer is no. No research thus far has shown that avoiding gluten benefits PCOS. So a blanket gluten-free diet recommendation cannot be made for all PCOS patients. Gluten-free diet is only recommended for people who have celiac disease, wheat allergy, or gluten sensitivity. It is unnecessary for the rest. For women with PCOS that report feeling better after going gluten-free, it is likely a result of eating foods that have less refined carbs. Now, if you face digestive issues and inflammatory symptoms like bloating and cramping and diarrhea, fatigue, skin rashes, headaches, nausea after eating foods with gluten, then you should get blood tests and intestinal biopsy done to determine if you have celiac disease or wheat allergy. Now, if you don't have any of these conditions but still have faced digestive issues when you have gluten, then you may have something called as non-celiac gluten sensitivity. Consuming gluten when having gluten sensitivity may worsen your PCOS as gluten increases inflammation in the body, right? So if you suspect you may have gluten sensitivity, please speak to your nutritionist and care manager at Veera Health. She will help you confirm this and will put you on the reducing gluten intake habit if you indeed are sensitive to it. So how will she help you figure this out? Well, as part of Veera's habit building program, she'll first help you eliminate all gluten from your diet, right, for 1 to 2 weeks. She'll ask you to reflect on how you feel. If you stop feeling bloated, have less cramps, and have improved digestion after eliminating gluten, that means that you are gluten sensitive, right? So, however, completely eliminating gluten from one's diet can be difficult and unsustainable, right? So to make your diet more sustainable, your nutritionist will reintroduce one gluten item in your diet for 1 to 2 weeks. and follow up with you, of course, on how you feel after doing that. This is how she will, test the extent of your gluten sensitivity. If your symptoms do not return after reintroducing one gluten item, she'll keep some gluten items, in your diet so that the diet is more friendly and more sustainable. If your symptoms do return, then she'll help you build a sustainable diet and nutrition habits that completely eliminate gluten in your diet. If you have celiac disease, wheat allergy, or gluten sensitivity, you can go gluten-free by avoiding wheat, barley, rye, and oats. So stay away from biscuits, baked goods, breads, wheat rotis, naans, noodles, etc. Replace them with rotis made up of jowar, bajra, ragi, all of those. You can also consume rajgira, kuttu, or corn flour. Brown rice and quinoa are also safe grains to consume. Apart from that, have lots and lots of fresh fruits and vegetables, seeds, nuts, and good protein sources like dals and pulses and eggs and fish, chicken, all of that. Moong dal chilla, ragi idli, zucchini pasta, cauliflower pizza, avial with red rice and brown rice, pulao are some yummy items you can have. Going gluten-free can be tough, but you still have a vast variety of tasty foods that you can consume. Your care manager will help you build sustainable habits to replace gluten in your diet. She'll provide you with amazing recipes, she'll monitor your progress, and give you some tips and techniques to stay on track. Make sure to send your daily meal pictures and to log your progress on our Veera app. We, of course, are all here to support you. You got this. Take care. Bye.